Well, we have some pretty good news on the COVID front for you. Cases, hospitalizations, and deaths have remained flat, and this is just from last week.
Yeah, but the FDA is meeting now to discuss the future of COVID shots. Our 3 News senior health correspondent, Monica Robbins, is with us now. So specifically, what are they talking about?
Quite a few things, and it's not necessarily going to be a pleasant meeting. So the FDA Independent Vaccine Advisory Committee is still in a virtual meeting discussing the future of COVID vaccines, including how often Americans should get one. And this comes as new data shows the bivalent boosters have been fairly successful against the new variants. Now, in a document released ahead of the meeting, the FDA proposed that future COVID vaccines will likely get an annual update based on the circulating strain. That would mean most people would only need one shot a year moving forward, similar to how flu vaccines roll out each year. Nothing official just yet. We're still waiting to hear, and of course they're going to make an advisory decision. Then the FDA will have to decide what they're going to do with it. Now, according to the proposed vaccination schedule, older adults and people with compromised immune systems may need 2 doses, and young children who received only 1 shot previously would also get 2 doses.
So talk to me about exactly what they're discussing. It sounded like you were going to say this could get a little contentious, but what specifically are they needing to decide together?
Well, they're also having to vote on whether to make all COVID vaccines bivalent shots, meaning they protect against both the Omicron BA.5 subvariant as well as the original strain. But you know as well as I do, as this virus continues to mutate, that could change. Now, the proposal is to decide in June and have the shots ready by September.
Okay, interesting. One more question for you, Monica. So vaccine makers, we're talking about Pfizer, Moderna, makers like that. I mean, what are the chances that they can do this in such a short period of time?
Yeah, from June to September.
Right.
That is a short period of time. They just did it, though, with the bivalent shots, if you remember last year. So Pfizer says it can deliver in 100 days, even if the vaccine has multiple strains. Moderna hasn't given a timeline, but managed to do it for the last bivalent vaccine. Novavax, however, doesn't have an mRNA vaccine and may have difficulty making the FDA timeline if that's what's approved. It doesn't even have a bivalent shot yet, so they propose picking the new strains in March, not June, so they could hit that time frame.
Wow, incredible.
A lot we're waiting on to find out what's next, though, folks, so sit tight.
We stay tuned. Okay, Monica Robbins, thank you so much.